This elderly gentleman was brought to me by a family member for the first time. His mild dementia prevents him from talking much and from understanding conversations. You can see the big toenail is loose, and there's a cheesy consistency under the nail. I placed his feet in a whirlpool bath for 15 minutes prior to trimming his toenails. This makes the nail softer and more comfortable for him to trim. As a result, the debris of dead skin and fungal material gets softer and gets that cheesy consistency. Due to the pandemic and his advanced age, his family felt uncomfortable bringing him out. He recently received his vaccines, so now they feel comfortable bringing him to the office. He has not had his toenails trimmed in over a year. I have several videos on my channel where the patient is brought to the office by a caregiver, either a family member or a professional. Some of the comments have been pretty harsh against them. What you have to understand is that caregiving is a very difficult job, especially when it comes to physically caring for the person. Often the person will not allow the caregiver to take care of their feet, either out of embarrassment or discomfort or pain. Often the caregiver is not equipped or trained to deal with the feet, or the caregiver does not have the proper equipment, or feels hesitant or afraid to injure the person that they're taking care of. Some commenters have accused the caregivers of neglect or abuse of their charge, and that they should be reported to the proper authorities. These cases are not cases of neglect or abuse. Neglect or abuse includes denying their client or their family member food or medicine and proper care. Physical abuse such as striking, withholding food, withholding clothing, bathing, things of that nature, bruising and things like that you would see from time to time in real elder abuse. These cases are not elder abuse. These are just instances where the family member or the paid caregiver is not equipped or trained or even allowed in their state to give proper foot care. So in this case, just like all the other cases I presented, the caregiver or family member was struggling trying to provide foot care for their loved one or the person they're in charge of. So they did the right thing and sought out the proper professional help. In this case, it was me, the DC foot doctor. So we're able to get these patients in, get their feet taken care of and get them on the right road and get them into some regular foot care so that the person will not suffer any more foot issues. This is proper caregiving. If you cannot do it yourself, or you're not trained to do it yourself, or the state does not allow you to do it, then it is the duty of the caregiver to seek professional assistance. So for this gentleman, having not had any foot care for over a year because of the pandemic, his caregiver brought him in, we're able to get his toenails trimmed and taken care of so that they will be better prepared and ready for medication so that we can get rid of his fungal infection, keep him nice and comfortable and happy, and make it easier for the caregiver to deal with the other issues that he has. If you have any questions or concerns about caregiving in the feet, whether you are a caregiver yourself, please feel free to email me your questions. My email address, as well as all of my contact information, are in the description of this video. Thank you for listening and watching, and enjoy the rest of this video as you see the transformation of this patient who's gone from a year without treatment to on the road for a cure of his fungal infection. This is Kevin Jefferson, the DC Foot Doctor. Thank you for watching this video. Like it with a big thumbs up and subscribe to the channel. Share it with your family and friends. For more videos like this, click on these. But most importantly, take care of your feet.